The best way to do neck exam, patient can be seated or standing. What we'd like to do is do an inspection to make sure there's no abnormalities in the direction of the neck or abnormalities in the musculature of the neck or any skin abnormalities, but then we'll check range of motion. We're going to have patient look at the ceiling to extension just actively, check active range of motion. If they get past 45 degrees, that's normal. If they get past 90, that's too much. We'll do flexion with chin to your chest. If you get within 2 inches of the chin to chest, that's normal. So this is normal. Come back up to neutral. We'll rotate to the right. That's lateral tilt to the right and lateral tilt to the left. And then back to neutral and rotate to the right. Yep. And rotate to the left. If you get past 45 degrees, that's neutral and normal. Come back up to normal. I'm palpating the cervical spine, and we want to palpate each spinous process if possible, because if they had an injury, fall in gymnastics or cheer or basketball, sometimes we can get fractures in the spinous process or even transverse process and pick it up by palpation. So one special test that's important is oftentimes the nerves coming from the neck will get pinched and cause shoulder pain. So we would like to check what's called a Sperling's maneuver. And to do that, we have the athlete tip the head back and rotate to the same side and keep going. And this causes reproduction of pain in the thoracic spine, in the shoulder, or down the arm. That's enough. We don't have to go any further. If it doesn't, we can apply some axial load. If that increases the pain in this distribution down the thoracic spine, in the arm, that would be a positive test. An alternative to this would be, if the patient's symptomatic, is to do traction and just elevate. As that relieves the pain, that's another positive finding that can be helpful. Last but not least is Lermite sign. Lermite sign is basically bringing your chin to your chest, what we did before. It causes electric shock-like sensation in the spine. This suggests a cervical spinal stenosis, sometimes also a cervical cord disease.